In the ambulance services, when we arrive on a scene, medical or a trauma scene, we need to be able to communicate with the individual to find out where they hurt, what their medical history is. We need to be able to get information from them to help us guide them in their treatment plan. Approximately, in the metro area, approximately 35,000. In the vicinity of maybe 15%. We've seen a larger population of Hispanic, a larger population of Hmong. We've also seen our state has a fairly high population of Somali. We have two options. There is, through our dispatch center, a language line that we can access. We also have the option of calling in if we're going to our facility, transporting to our hospital. We can call in there, and there are some language interpreters within the hospital system, and they can access that and by way of phone help us to interpret it. Otherwise, we're left with the family at the scene or the friends if somebody happens to speak English, or at least some broken English. Most of the time that's the option we take, and it's serviceable. We've used it. It's not always 100% effective. We're not always sure that the interpretation we're getting is fully accurate, but it generally becomes our best option. Well, again, for us to do what we need to do optimally, we need to know the circumstances behind the injury or the illness. We need to know the symptoms. We need to know what kind of medications they're on, what kind of past medical history they've had. So it's important that we're able to communicate and get the accurate, true story from that individual. It keeps me hands-free. It takes me away from having to dial a phone and go through that process. It seems to interpret accurately from what I heard of the demonstration here. It looks like it has a lot of potential to be an extremely helpful tool to us in the field.
Please take a brief moment to complete the survey to help us better understand your needs for interpreting services in your industry, so we may better be able to design the best possible solutions.